Events that once seemed unimaginable in this nation have now been going on for almost a half a year, and for too many there has been enormous loss. The COVID-19 pandemic is still very much a part of our lives, but despite its toll, Illinoisans have demonstrated an unsurpassed spirit of generosity and compassion for their friends and neighbors and their communities. And so many have met this moment and done so much good. 6 months ago, when the virus was just beginning to disrupt people's lives and so many were badly in need of assistance, I knew that we would need to offer not only help from the public sector, but also from the private sector. And so I called someone who I knew I could discuss the options with, my sister Penny Pritzker, who also happens to be the former U.S. Commerce Secretary. And she immediately volunteered to grab the reins of the effort and to lead. Already the need was unfolding beyond a scale modern-day government had ever seen. And the best response would be all hands on deck, private and public efforts alike, to meet it. Penny's never heard of anything that she didn't do all the way. Within a week, this initiative had launched, and she had an incomparable job steering it, building a team, and raising tens of millions of dollars from individuals, from foundations and corporations in record time. With that, the Illinois COVID-19 Response Fund was born, and it answered the call when our state needed it most and before the federal government had begun to help. When the family bills couldn't be paid, when people were trying to find connectivity for work and school, when pictures of empty grocery stores went viral on social media and paychecks were unpredictable. In no time at all, the fund was addressing the need and donors were stepping up. To all the Illinoisans who joined this effort, to Penny and the Response Fund team, large corporate donors, family foundations, small businesses who stepped up to help their neighbors and each other out, every individual who gave what they could spare to help out those in need. On behalf of a grateful state of Illinois, thank you, thank you, thank you. With today's fifth and final announcement of $7.5 million in grants, the fund will have distributed over $30 million around the state, serving over 114,000 families in the first 3 rounds of funding alone. And importantly, that support hasn't just been fast, it's been smart, it's been fair and equitable. This final round of funding operated with an eye for the disproportionate burden that this virus has placed on the shoulders of communities of color, both financially and physically. In making its decisions about what supports to offer, the fund looked first at where there were a dearth of dollars already available. They quickly saw that only pennies on the dollar have historically reached beyond the Chicago region. So the fund intentionally directed significant funding to residents of Central and Southern Illinois. One of the grant-making working group members from downstate said, "Stories in our local newspapers show how the fund changed the trajectory for folks. Organizations here are grateful that they could participate." There are many stories of how the fund benefited those most in need, and I'm grateful to be joined today by 3 grantees of the fund to share their stories for themselves. Alexandra Sosa, the Executive Director of the Farm Worker and Landscaper Advocacy Project, which received a $900,000 grant to provide direct cash assistance to Latinx community members. Tracy Dace, the Executive Director of the Dream Opportunity Center, which received $400,000 for a workforce development initiative focused on serving Black families and individuals. And Elise Sawyers, Executive Director of Community Health Partnership of Illinois, and the recipient of the largest fund grant to provide healthcare services in rural communities via a mobile medical unit. Of course, we don't celebrate this fund in a vacuum. This pandemic is not over, and the need throughout the state is still great. I'm grateful to those behind this project and Illinoisans across the state for continuing to rise to meet this moment. To those who are still interested in giving, the Illinois COVID-19 Response Fund website remains a resource. There you can find a list of many of the great organizations serving communities in every corner of our state. More information is available on Illinois, that's IL, COVIDResponseFund.org. Let me say that again, IL, COVIDResponseFund.org. I also know that Illinoisans need space to grieve and to heal. And while the challenges visited upon everyday lives are many, the greatest pain of all is the human toll. Today we said goodbye to another 7 Illinoisans. May their memories be for a blessing. Such a loss has a profound impact on all of us. With many of our traditional methods of grieving and honoring those we lost put on hold by this virus, I want to invite everyone to tune in tomorrow to our second COVID-19 memorial, streamed live from Springfield at 6:30 p.m. In the meantime, let us find solace in the incredible commitment of Illinoisans to be there for one another. And with that, I'd like to turn it over to Penny Pritzker, the intrepid and successful leader behind the Illinois COVID-19 Response Fund. Penny?
Good afternoon. I'm incredibly honored to have led the Illinois COVID Relief Fund team, and I'm also really pleased to be here today. When my brother first asked me to chair this effort, frankly, we did not know what was ahead of us. We did not understand the duration or impact of the pandemic. We did not have a team, a timeline, money, infrastructure, a plan, or even a name. We just knew there was such a vast and immediate need throughout the state caused by the COVID-19 crisis. So we started calling for support, and everyone answered the call. This was truly an all-hands-on-deck moment and an all-hands-on-deck effort to help our most vulnerable. And I was blown away by the generosity and commitment of so many people to this important cause. Generosity of treasure, and also generosity of time, of energy, and of resources. The ICRF endeavor has shown me the best of our state, and that there's no doubt when we Illinoisans put our mind to it, we can be many communities united together as one determined voice and one determined purpose, and that we care deeply for one another and we take good care of each other. We assembled 2 respected groups of volunteers to assist us with the process of identifying and making grants to organizations that could reach individuals and families in need, a grant-making working group, and a steering committee. These groups were comprised of civic, philanthropic, and business leaders from across our state. Leaders from downstate and central Illinois went to work with Chicagoans. Most of us had never met each other before. In fact, I have to confess, I met 2 of my working group today at this event. We also had staff who took leaves of absences from their jobs, dedicating themselves and countless hours to working for this cause. We quickly went to work raising money for this important effort, and we began by swiftly deploying our funds. Remember, at those dark times, so little was known. As hospital ICUs were filling up, food pantry lines were growing exponentially and staggering job losses mounted for the as we fully stopped our economy. People were absolutely terrified about the health of their families and their livelihoods. And frankly, of course, so many still are. Our goal with the fund was to provide help to Illinois residents who were suffering from the most basic needs. This included emergency food and basic supplies, interim housing and shelter, primary health care services, utility and financial assistance, support for children and other vulnerable populations, and nonprofit safety and operational assistance. At first, we prioritized quickly getting the funds to communities throughout the state, with over $10 million distributed within the first month of the stay-at-home order in Illinois. We did it by leveraging our trusted partners in the local United Ways and community foundations across our entire state, because they best knew the needs of their communities, and they best knew on-the-ground local organizations who could provide that assistance. In total, we distributed over $31 million to more than 1,650 organizations working on the front lines of compassion through direct and re-granted funds. So far, we know the fund has supported over 7 million meals to almost 200,000 families, provided over 19,000 families with direct cash assistance, assisted 8,000 families with utility assistance, and 5,250 families with short-term rental assistance. Individuals and families across the state were provided 4.8 million pieces of supplies. Families, emergency workers, and others needing a safe place to sleep were provided with 27,000 nights in emergency shelters and more than 11,000 health and mental health visits. These numbers will steadily grow as we receive reports from all of our grantees. In the beginning of this unprecedented crisis, when speed was the most important and it was critical for us to get to the most vulnerable in our society, and when uncertainty was the highest, our fund's resources filled that dire early funding gap. As the governor said, though, as time went on and we learned more about the impact of the COVID-19 virus, it became clear that some communities were disproportionately more impacted by this pandemic. So we found 5 demographic groups were most impacted, including the African American community, the Latinx community, seniors, the impoverished rural communities, and our significant undocumented community. So for our 5th and our final round of funding, which we're talking about today, we really homed in on the underlying systemic inequities that COVID laid all too bare. And racial inequity emerged as a further focus of our grant making. For the ICRF's 5th and final round of funding, we specifically sought out organizations that primarily, but not exclusively, serve Black and Latinx communities, and equally important, that are led by Black and Latinx individuals, or are in meaningful partnerships with such organizations. We wanted to lift up Black and Latinx leaders throughout the state that would help their local communities meet today's basic needs, while also creating a lasting impact beyond the life of the fund. In this round, we funded 7 organizations throughout the state that are already doing great work. And we believe they will continue to broaden and deepen their impact through these grants. As the governor said, 3 of these grantees are here today. Alexandra Sosa from the Farm Worker and Landscaper Advocacy Project, Tracy Dace from DREAM, and Elise Sawyers from Community Health Partnership of Illinois. Each of these grantees embodies our goals for this round. Each of the three individuals that you will hear from today are incredibly dedicated, capable, indefatigable leaders. They're from communities that they are serving. They are already doing critical work in their communities, and we hope that our grants from the Illinois COVID Relief Fund will be able to amplify their impact today and for the foreseeable future. So let's hear from them. And let me begin by introducing Alexandra Sosa, the Executive Director from the Farm Worker and Landscaper Advocacy Project, FLAP as we call it, to discuss the work of her organization and the impact it is having on people throughout Illinois. For more than 30 years, Alexandra has worked on community outreach and education for very low-income Latino immigrants. FLAP's mission is to improve working conditions for low-income workers and their households in the following industries: cannery, farms, greenhouses, landscaping, meat, nursery work, packing house work, poultry, restaurants, and snow plowing. Our ICRF grant will help support the organization's mission of supporting farm workers and the Latinx community statewide. So thank you, Alexandra, and welcome.
Good afternoon. As a Latina woman, I know the struggling of our very low-income Latin community. I want to take this opportunity to thank you, the Illinois COVID Response Fund, for giving us the tools to fight this pandemic. Our very low-income Latin community is struggling. They are in the fields. They are growing the vegetables that we have every day on our tables. They are infected by COVID-19 because they are not able to work from home. With this grant, we are going to be able to provide direct cash assistance to these very low-income hard workers. We are going to make a difference and provide the cash assistance directly to almost 800 very low-income workers, making an impact of almost 5,000 households. We are also going to distribute 100,000 community education on COVID-19 information and resources. We want to thank you so very much for the support. Muchísimas gracias.
Thank you, Alexandra. I'm now honored to introduce our next speaker, Tracy Dace, who is the founder and executive director of DREAM Opportunity Center in Champaign, whose mission is to reach, teach, support, and empower boys and young men ages 5 to 24 who face tough odds, such as school suspension, mental health issues, parental incarceration, and low academic skills. The DREAM Center teaches essential life skills throughout their curriculum: collaboration, contribution, self-regulation, adaptability, attachment, and belonging. It teaches these skills to prepare dreamers for college and career success, including parenting and caregiving skills to serve as leaders in their schools and communities. Our ICRF fund will support DREAM in their work to provide multi-tiered, evidence-based system of support services focused on employment, mental health, and holistic needs in the Champaign County. Thank you, Trace, and welcome.
Thank you and good afternoon. I'm very humbled to be here and so thankful for this award. For this grant from ICRF, DREAM has partnered with the Well Experience, another nonprofit with the mission to reduce the gaps in opportunities and achievement among Black children, young adults, and families placed at risk. As partners in this grant, we will implement the Hope in Action project in Champaign County, primarily serving communities of Champaign, Urbana, and Rantoul, where unemployment and mental health issues are rising. We will serve 300 participants through a multi-tiered, evidence-based system of supports and services that are accessible, coordinated, and take a holistic view of the individual and families. Specifically, we will engage 20 families in wraparound services and culturally responsive supports with a focus on healing from trauma. And we also will form a community team that will design individual level and small group interventions to address gun violence and the school to prison pipeline that has derailed so many Black young lives in Champaign County. We also hope to support and plan to support 25 young adults, and they will receive career training and other supportive services such as life coaching, because we want to increase their life opportunities and disrupt generational poverty. Last week, one of our young adult dreamers contacted me and shared some very inspirational news with me. When he came to Dream, he was unemployed, homeless, and also formerly incarcerated. We helped him by obtaining construction training and other life skills and gave him hope for the future. He now has a full-time job and he's definitely on a path to success. He wrote and said, "I'm building my life and Dream is a big part of that." We are thankful for the ICRF grant and that will assist many more Champaign County residents. Our hope for the future and our action will take place by creating program models and partnerships to build microsystems of care for youth and families in our community. And we also will reach, teach, and empower youth and young adults to build career pipelines that will disrupt generational poverty. Thank you very much.
Tracy, thank you very much. I'm now honored to introduce our next speaker, Elise Sawyers, who's the Chief Executive Officer of Community Health Partnership of Illinois, that provides comprehensive, patient-centered primary health care for agricultural workers and families throughout northern and central Illinois. The ICRF fund will help support their work to provide a mobile medical clinic and telehealth resources for migrant farm workers and rural communities, specifically serving Champaign, Kankakee, LaSalle, and Peoria. Grant funds will also be used to expand their Mendota Health Center. Please.
Good afternoon. Thank you, Penny. Thank you, Governor Pritzker. My name is Elise Sawyers. I'm the Chief Executive Officer for Community Health Partnership of Illinois. I joined the organization January of 2020. Our organization, CHP for short, for the last 50 years I've been serving the migrant agricultural farm workers. In 2019, we served over 10,350 patients. This year, just really looking at some of the social determinants of health and looking at the needs for transportation and what COVID-19 brought to us, we quickly identified the need to reach our patients where they are. We're very thankful on behalf of the Board of Directors staff of Community Health Partnership of Illinois. We thank you for this support. It will go tremendously a very long way as we will be able to go into the community, reach our patients, serve our patients, provide COVID testing, provide medical and dental care. As we have noticed and seen with and during COVID-19, our dental practice went to zero in terms of utilization. We're just now up and running. We're scaling at 30%. Being able to go out and reach our patients and provide telemedicine, telemedical, and tele-behavioral health, the mobile unit will go a long way. Not only will the mobile unit, but this grant will also enable us to identify 2 dedicated outreach teams that will service 4 of our locations in Kankakee, Mendota, Champaign County, and as well as Princeville. We have a new site in Princeville. We've been COVID testing in Princeville. We go to all the farms. We go to places where farm workers live. We try to test and collaborate with community partners to test prior to farm workers coming into the state. We collaborate again with employers to be on premises, to test, to share information, to educate, and to make sure all of our community residents understand that we are a safety net for the underserved and uninsured, and our doors are open to all. So again, thank you for the opportunity. It's been a blessing, and I'm very grateful to be here. Thank you.
Always let your big sister go first. I do want to just say a couple of words before I call on the media for any questions you may have, and that is, you can see we have some amazingly dedicated people standing here today, but there are so many that you don't see standing up here who are on camera, people who are off camera, people who've been just working, toiling since the very beginning of this pandemic to make sure that this fund operated in a fashion that I think everybody could be proud of. And I just wanted to point out that I can't name them all. I can tell you, though, that from moment one, when Penny started firing up the phone lines and calling people around Chicago to get them engaged, people at Chicago Community Trust, people in all parts of the state, United Way, community foundations downstate, not to mention all of the givers from all over the state. It's just been an effort that I think all Illinoisans should be very, very proud of. And I, of course, am very proud of my big sister, and I should properly say, since she called me governor, Secretary Pritzker. So that having been said, happy to take questions from members of the media.
Does this mean that the fund is done, or do you continue? What's the status?
So the fund will be winding down its fundraising operations and its grant-making operations. It's in that process now. That's not to say that there isn't tremendous need out there. And we are encouraging people, in fact, to look at all the organizations that were vetted by this fund that around the state, 1,600 organizations across the state that are so terrific. They're really delivering for the people of Illinois during this terrible crisis. And so those are available on the website that I listed a little earlier. You can go to their websites. Many of them have the ability, give you the ability to donate directly, but you can also reach out to those organizations to see how you might help with your time. But we want to encourage people to continue to support these organizations because they really are doing God's work.
But there might still be difficult days ahead.
There are.
That's the part that I wonder, why not
Sure.
continue, or is it just you've reached your max on how much you can?
No, it's a great question. Thank you. But remember that when we started this fund, the federal government hadn't gotten involved in any way. The state government, we were literally in crisis mode and trying to deal with the issues of, as you know, we had to close schools, we had to put in a stay-at-home order and so on. And it was very difficult to reach all of these places that needed help or to identify everybody that needed help. And so it was great to have this independent private organization that could move much faster sometimes than government. And before the federal government could get involved. Now, of course, as you know, there were COVID relief dollars that were provided by the federal government specifically for the kinds of things that this fund had been aimed at. And there are some things that this fund was aimed at that the federal government was not. But all of it are focused on people in need across the state. And so this is not to say that this pandemic is over or that the need is over. There is a great deal of challenge that is facing families across the state, and I want to encourage those who can reach out to do so to help in any way that they can. And I will say, and you've heard me at other subsequent press conferences since March, talk about the many, many people who are giving of their small businesses, who are just out there helping by handing out meals, by helping people who are in need that are in their own communities, and that continues.
But at some point in time, you're going to need more federal aid. And what are any ongoing talks? I know Mayor Lightfoot mentioned today that she's still waiting to hear back from President Trump. Have you any communications with his administration, or are you relying solely on Congress and the Senate to pass another stimulus plan?
Well, we're certainly dependent upon Congress to step up to the plate. You've heard me many, many times communicate about the need for state and local government funding, because it is through the government, as you know, the state government and local governments, that many of the services that people rely upon are provided. And I'm very, very concerned that our social services, our human services across the state will be diminished significantly if there's no funding provided. There was a lot of revenue lost as a result of COVID-19 all across the country. I just read an article about Florida and their $5 billion hole that they're trying to figure out how to fill. Not to mention in New York, it's something like 11 or 12 billion. California, I think it's reached almost 20 billion of need, and it's just happened all over the country. And I'm very hopeful that Congress will step up during this month of September, to do the right thing, and that the president will sign it.
What's the whole year for Illinois?
It's about $5 billion in this fiscal year.
Governor, could I ask, related to that, Senator McConnell has put out a statement today, I'm sure you're aware of it, that he's moving today to put in position a vote on the Senate floor later this week on a bill that Senator Schumer and Speaker Pelosi say doesn't fill the bill precisely in part because of what you just cited about state aid. What's your view of McConnell nonetheless says the people need it, let's move forward on this, and we can take the state stuff later?
Well, I think that Senator McConnell is not listening to the constituents in his own home state. His home state also has an enormous need. And what they're putting forward, if it doesn't have state and local funding involved, falls short of what's needed. And look, it's not just because we've got human service needs across the country that need to be filled. It's also because it will harm the economy of the country if there are massive layoffs that occur as a result of a failure of state and local funding. Let me just say one other thing. Big corporations all across the nation have received billions and billions and billions of dollars of aid. But now when it comes to the very social services, the very education, the frontline, first responders, our police and our firefighters, now they're going to fall short. Now they've decided that they want to tighten the belt and not give any more to help people. It seems illogical to me.
One other, I'm sure you saw that there was criticism of the awarding of cannabis licenses. Would you care to respond to that? And again, that African Americans have been shortchanged is the complaint.
Well, let me start by saying that the social equity focus of the cannabis industry and how it was created, this is a marathon. It's not a sprint. We've said that all along. We've had to, focus on making sure that at each step, the diversity that we all want, the diversity, the equity, the inclusion that we all want from this industry is in fact brought to bear. We know that the announcement of the applicants, that are going to be in the lottery has caused some confusion. But this was the process that was laid out by the legislation. And we also know that there will be changes and fixes along the way. There are about 400 other licenses that will be awarded. But just to give you a sense, in this round of licenses that were awarded, 100% of the finalists, the 21, are social equity applicants. 2/3 of the applicants were 51% owned by those who come from disproportionately impacted areas. 62% of the owners are controlled by people of color, owned and controlled by people of color. 20% of the owners are people who had been arrested or convicted of a crime that's now eligible for expungement under the law. So the law itself has a lot of good in it. It's being effectuated. This is one step along the way. As you know, there will be a study that's done about whether it's actually doing what we all want it to do. And I'm on board with, when people think about, are there changes that need to be made for the next rounds of licenses, that we ought to work together to make sure that happens.
Some are asking you to stop the lottery, not have it because they don't feel that it's fair. Would
Sure.
you consider stopping the lottery?
Well, that's not something the law allows, but we'll certainly as far as I'm concerned, we want the ultimate outcome, and again, I said this is a marathon, not a sprint. We ultimately want the outcome to be as we all have hoped and intended. I do want to ask, I've got former Senator Toy Hutchinson, who works in our administration and is, our leader on this effort.
So we knew that this was going to be we're talking, right? We knew this was going to be an exciting time, but also a very, very disappointing time for the people who didn't make it to the final phase. We had over 4,500 applications for 75 licenses across 17 regions. So again, 4,518 applications for 75 licenses. There was bound to be a lot of disappointment for this first round, especially since it's a really incredible time to think about people who could see themselves being a part of this. So one of the things that was shocking when this all happened, or when it all got whittled down to these 21 entities who could apply for up to 10 licenses apiece, who are in this final round, that over half of the applicants themselves in the final round are people of color. There's 0% people of color right now in the current industry, 0. And nationally, it's 4%. So when we think about where we're starting from and how far we have to go, and the fact that we built in the pause to make sure that if it doesn't do what it is we intend for it to do, that we would continue to make it better. 80 years of failed drug policy is going to be really difficult to do in one bill. But how far we've come in 9 months, we've expunged 10,000 criminal records. There's been the sales of this have been through the roof, in the middle of a global pandemic, which is targeted to those very communities that are disproportionately impacted. And then we fight to get to this lottery round, this place in time where we'll see whether or not we can diversify the actual industry itself, targeting a population of people to see what kinds of demographics would come out of that. We ended up with 13 out of the 21 actually being owners of color. So, this is, we knew that this was going to create a firestorm. It's the thunder heard around the world. But we also know we can get to 500 licenses, and there's so much further to go.
But can't you get a state rep to author a bill to, suspend the lottery system and do it a different way?
Well, the lottery system is done based on the statute now and the rules that were done as to when you have to do it after, that happens. This is really designed to see how the process ends so that you can then be surgical in its repair as it's tweaking, as we're going. We have at least 2 more rounds of licenses to go. Very small beginning with only 75 licenses was to figure out all the things we thought might happen and to deal with the things that we never could have known what would have happened until you went through this process. We said that all along, like hard lid on the market if it doesn't do what it is we said it was going to do. And I'm just really looking forward to the time when we can understand all the pieces, understand exactly what happened, deal with this process as it is, so we can then go back to the legislature and change this historic legislation to keep getting better each time.
Just at that point, and the governor earlier, a few moments ago, referenced tweaks or fixes. What, for example, are you looking at? What are the issues you're studying?
Yeah, I think that the sheer number of applications that we got, we need to put a limit on how many you can apply for at one time, so that you can't have really heavy moneyed interest apply for way more than what your regular folks can apply for. Like that's one thing. I think another thing is to go from just doing top scores to doing a cutoff score, so you can also expand the pool that way. Again, things that we wouldn't have known how they shook out until we saw what happened as it shook out. So moving forward, a lot of people have some really good ideas about how to continually expand the base of people who've been historically locked up and locked out of this. And we still are on track to see some significant portion of ownership that goes to people of color, which does not exist at all anywhere in the country. So this is a long game. We always knew it was going to be a marathon, and we knew this would be the hardest, most crucial point, is that what would happen in these first rounds. So the next few weeks we'll also hear for the Department of Ag and Craft Grow and Transport and Infuser, so we can look at all of the license categories, the application itself, the applicant pool, and what to do next to continue to make this the most equity-centric bill that we could possibly do that exists anywhere.
We'll do two more.
And I just want to say one other thing, if I may. Sorry. That is that, just to remind you, I said a little earlier, but I think it's something to take note of, that 62% of the applicants that are in this lottery are owners who are people of color. That's a pretty good number. And when we're done with this process, we will have the largest percentage ownership by people of color anywhere in the nation. And there are now 11, maybe 12 states now that have legalized. And so I think that's just something to take note of always. And I think everybody who's been involved in this process from the very earliest moments have said, we're going to have to make little changes along the way as we learn from the process. We're literally creating an industry, and by virtue of this law, going from zero to what is, I think, already a major industry. And so we want to make sure we get it right, and that's why it's been done in a ratable fashion, in a fashion that's allows us to make those changes along the way.
Speaker Madigan, there will be the investigative hearing. You said you were anxious to have some questions answered that begin on Thursday.
Yep.
What questions do you have that you would like answered?
Well, I think they're all the same ones that many of anybody who's been reading the documents that have been put forward by the U.S. Attorney's Office raised, right? There's so many things in between that you don't know because it was really focused on ComEd and not on these ancillary players. And so these are all, I think we're starting to see other players. There was the indictment that was rolled out, I think, on Friday. And that, that adds to, your understanding, or our understanding, all of us, of how one might think about the questions that should be answered. But there's an awful lot, and I think that's something for an inquiry, not something just to throw a question out here at a press conference.
Last question.
Governor, can I ask about the nuclear plants? Are you open to an additional subsidy for Exelon? And do you view this, as some members of the General Assembly have termed it, extortion, as though they've stuck a gun in the ribs of Illinois ratepayers? Stick them up?
Yeah. What I would say is that what we don't know what the real financials are for those power plants. We just don't know. And I believe that before you can even enter a negotiation about that, the question of whether there should be a subsidy, you have to understand what the real loss is. Is there a real loss? And what is that? We don't want to lose any power generation in the state of Illinois. Nobody wants to lose power generation in the state of Illinois, but we're not going to overpay. And I believe that there hasn't been transparency, and that that FEJA, when it was passed, wasn't transparent. That's now clear from much of the information that's come out. We need to know much more, and so that's why. Look, however you want to refer to what they're doing, it's clear that they're attempting to threaten, because this is a negotiating position for them. This is what they did back during the negotiations around FEJA, right? That's their negotiating tactic. All we're saying is we're not doing anything until we know what the real numbers are. So, to forget this, that they get to threaten us. We're saying back to them, show us. And by the way, this is a company that is now going through a process with the U.S. Attorney. It seems to me they ought to be forthcoming with information so that the people of Illinois don't get taken again.
All right, thank you very much for your homework, Governor Pritzker. Tonight, people in Wheaton are having a rally to get back to in-person learning.